annotations to train AI models. First, we collect the data, the basic step, data collection. After that, we label that data. So data annotations is one of the very, very significant step before in future, once you're going to be working for AI models, data annotation is the basic step because you annotate that data and then annotated data is fed to AI for training for the machine learning model to learn. AI learns to this and then you test it. Testing में क्या होता है कि जिस मॉडल जिस सोर्स के थ्रू द नंबर ऑफ एक्स रेज फॉर एग्जांपल इफ आई टॉक अबाउट जो एक्सरेज हमने लेबल करके जिसकी बेसिस पे मॉडल को ट्रेन किया होता है हम उसी डाटा सेट में से कोई भी इमेज उसको दोबारा उठा के दे देते हैं टू टेस्ट इट कि उसने कितना एक्यूरेटली उसको लेबल किया है वंस इट इज पास दैट स्टेप देन वी गो फॉर वैलिडेशन अब वैलिडेशन में क्या होता है कि उसको एक अनसीन डाटा सेट से कोई भी इमेज प्रोवाइड की जाती है टू असेस कि उसने कितना एक्यूरेटली अब उसको लेबल करके दिया है once it is past these basic two testing and validation step we make our models live उनको हम डिप्लॉय कर देते हैं एंड the model currently we are working on as you have heard of identify it is currently deployed और हम उसमें जितने भी OPDs वगैरह हैं that is basically live जिसके थ्रू हम diagnosis या treatment planning में उसकी help ले रहे हैं तो this is my part the data annotations holding a very significant value when when talking about machine learning models and AI and specifically for AI and dentistry I would now like to hand over to Nermeen, who will talk about more about these projects and the diploma we are going to start. Thank you.
Okay, assalamualaikum everyone. This is Dr. Naeem Asar. First of all, I'll begin with my introduction. So currently, I'm working in LUMS as the medical lead and project lead of one of our projects, which is called as Sensei. That is primarily focused on AI in healthcare. It's a project which comes under the umbrella of AI in Healthcare Initiative, which is currently deployed and working in LUMS. And also, I'm working in AI Identify. If possible, can someone please screen share my presentation? Okay, if meanwhile that happens, I will let you guys know about certain advancements which are happening in AI in healthcare. Before I guess with that, I want anyone of you guys to share any opinion or any question if they have like regarding the AI in healthcare initiative. And so far, if they have any question regarding which Dr. Baryal, Dr. Daniel shared with you guys. Anything else? Anything anyone wants to share? You guys can just raise your hand. If there is like no question, we can proceed forward. Okay. I assume that there are no questions, but probably after I say like after I deliver my my subset of like presentation, I'll probably ask questions from you guys because again, I believe that this presentation should be interactive so that any sort of ambiguity which persists, we can discuss about that so that the main idea of the presentation and of course the entire module would be that you guys will be communicating because this should not be a didactic sort of lecture. This should be like you guys should participate and resolve all your ambiguities which you guys have because as Dr. Baryal mentioned that over the period of time we have learned, we have evolved and about AI and of course AI component in health tech. So of course what we have learned over the period of over the period of like 2 to 3 years we would love to share with you guys. So the ideal thing would be that whatever sort of ambiguity thought perspective anything you guys can share that with us. Okay, so again I am supposed to talk about AI in healthcare because I am primarily like on ground working with that aspect. I believe that AI in healthcare is something which is again going to transform the idea of medicine in such a manner that lots of tasks which requires lots of manual effort that would be automated or that would be absolutely automated, which includes like note taking, which includes for example which includes like the conversations which we have with the doctor because most of the time the half of the effort and time period of the physician or the doctor or the dentist is like scribbling down the notes, or giving patient the instructions, or giving patient writing the order or notes for the patient. So I believe that takes a lot of effort, and that takes a lot of the energy of the physician, which should be primarily focused on the patient, right? So I believe that AI intervention in healthcare is going to transform the patient physician interaction in such a manner that it's eventually going to it's eventually going to make the interaction more patient focused. So the idea and the core of medicine that was said to be like that, it should be patient driven. The goal should be as such that it should focus on the patient healthcare more. So I think the empathetic element based on which we feel like that we physicians, or like we doctor dentists healthcare professionals feel like should ideally be the goal. We believe that the AI incorporation within the health would definitely make that easier. For example, if they can transcribe the notes for us, if they can automatically generate the order and if they can automatically generate the order, and they can give the instructions, and they just can send it to the pharmacy, and the automated generation of the order notes to the pharmacy, to the to the paramedical staff, that's going to make the life so much easier. So the efficiency and efficacy of the entire process and the automation is something which is the target of AI intervention with the healthcare. Because I don't know if you guys have heard about that, but most of the hospitals, because since I have worked on ground, so most of the hospitals at this time, if I talk about the government sector, or even somewhere in private setups also, which are small setups, most of the time all the reception work and all the work in which the medicines are recommended, they all are done on paper. But the world is transitioning from the paper to the tech side, right? Because this transition is not only important that it's just a transition of like tech is existing, but it's a need for us. So I think this sort of transition is extremely crucial for all of us to learn and to adapt. Because again, as Dr. Baryad mentioned, that this is not a replacing quotient. This is going to synergize our information, our strength, and our abilities to perform in a better way. So of course, I truly believe in such a manner that those physicians, those doctors, and those healthcare practitioners who are not very well aware of the AI would definitely be replaced by the physicians and doctor and healthcare professionals who know AI in a much better dimension, in a broader perspective. So I think that transition is very important. So I think it's a beautiful synergy if we learn with the manner that we adapt towards it, we learn with it. And of course, if someone can just swipe to the next slide, that would be great. Okay, I just want to make sure that yeah, of course, that any transition is not smooth and is not easy. Because if we talk about that बहुत ज़्यादा world major revolution also, I believe the invention of electricity was in its time was one of the very sacred, and one of the invention, and in which like people were very apprehensive that how it's going to look like, because they feel like, oh, like electricity, that means that it's kind of dangerous to work with. So the concept, and I believe the kind of reactions we receive towards AI in these times is like kind of similar, because there is a this apprehension that maybe we'll be replaced, maybe we will be asked to switch our jobs. So I believe that again, now we see that अगर मैं आप लोगों में से किसी से भी पूछूं इस point पे, that if you can tell me the number of your best friend, I believe that आप लोगों में से शायद maybe शायद उनकी बहुत अच्छी मेमोरी हो, शायद उनको याद हो, but I believe अगर मैं किसी से भी पूछूं तो शायद उनको अपना फोन चेक करना पड़ेगा in order to just check the basic thing, right? The phone number of your best friend. So I believe this is how AI is eventually going to take the role and take the invention in such a deep core. It's going to be such a deep rooted invention that yeah, that's going to have a long lasting impact in our day to day dealings. I mean, a simple example that all of us use GPT in such a manner that we can't. I use it daily. Like it's yeah. Sophie used for this Gamma AI. Gamma AI is in itself is a tool. It's basically used for making presentations, for making web pages, for making documents. It's a very great it's an AI tool. It's easily available. It's a you can use it freely, and after that you can buy the subscription if you want to use its paid version. But I think for your individual respective Google account, you can create it and you can use it. So it's a beautiful AI, software. You can easily use that. It's a tool and it's very easy to use. And I believe for the healthcare professional, you guys can use it, daily in your presentations and in your day-to-day activities. So yeah, I mean, of course, there are really real world application and challenges, because again, the infrastructure and the kind of cost which is associated to its implementation is humongous, which is kind of a hindering factor for the developing countries like Pakistan. So I feel like in times to come, probably the kind of transitioning is happening. Probably will figure out the way that. If the LLM exists, then the medium language models and small language models, I mean, the talks are happening that going to exist. So most of the work maybe can shift from the GPU to the CPU. So these sort of invention when happen, because currently the cost of GPU of for any sort of like software is exponentially high, right? If we actually use it to train our like language models, or probably model any model, right? AI model. So of course this transitioning and the cost thing is in times to come, or is a factor जिसके ऊपर बहुत सारी चीजें depend करती हैं. And of course authorities and people are actually working at how substantially they can morph it, reduce it. So yeah, that's what the idea is. And of course one of the main concerns which I believe that AI brings with it is the ethical implication. So for that, I believe that the legislations and the implementation should be as such that that considering all the ethical implications, biasness, algo things, the implications and the entire idea of how the AI should be implemented, we should create the curriculum. If I talk about the education in such a manner that this is catered, because we cannot stop students from using AI. I mean, if we stop, then we are actually blocking them from the reality, because AI is now a reality. And I don't believe that we cannot stop the generation, or probably new upcoming healthcare professionals from using it. But we need to come up with the idea and the strategic planning in such a manner. We need to design the curriculum, we need to train them in such a manner that they use it, and based on their usage and based on how they use it and imply it, we make them happen and make them realize that how they can use it in such a manner. So it's our responsibility, and of course it's on our shoulder that how we further modify and train ourselves, that if we are in the position that we need to train the upcoming professionals, then we need to have a much better competency and knowledge about AI. So yeah, I mean that's the idea. And of course the ethical implementation, the I know that ethical implications which exist in the West is like HIPAA and many more else which exists, right? These are closely working on and making developing new policy day by day, how AI is eventually going to become the part of the of your day-to-day activity. So what's important is that in Pakistan also, I believe that these rules should be built in such a manner that we are able to use it in a proper manner, in which the all the limitations, which includes the biasness, the algo problem, or like data security or patient security. All these things are not by force, and these are like preserved, and patient sanctity, which is the most important thing I believe for the professional, is maintained. So I guess that's the basic crux of my presentation. And I feel like the quotient which I really always focus on is that the idea of AI in healthcare integration, or the idea of health tech, is a very it's not a very novel concept, but it's a very very believable concept. So I think all healthcare professionals should definitely learn with it. Should actually synergize with it, rather than just opposing the concept that this is going to ruin. I believe that of course the cognitive performances in times to come is probably kind of hampered with the constant use of GPT. If I talk about the healthcare professional or academic side, पे teachers का ये perspective है कि cognitive load is comparatively kind of hampered with its invention. But why don't you guys, like, I feel like that's my perspective, why don't you guys feel like that the cognitive element can actually be creatively and intuitively challenge in that manner? Because the idea lies ke हम लोगों को किस तरीके से assess करना है. So the assessment criteria can be changed, which includes AI. So yeah, blocking any invention is not the solution, but learning, adapting, and of course evolving with it is something which is going to make a very good difference in times to come. So yeah, hoping that it works best for all of us, and happy AI learning, I believe, for all of us.